Hi, I'm Dr. John Martin for Ivy Family Health Updates. Here today with my brother, Dr. Edward Martin, and my sister, Dr. Catherine Martin. And today we are going to talk about brow lifting. Now, I do a lot of cosmetic surgery, and frequently people will come in and say, I want to have eyelid surgery done because I see all of this excess skin through here. And for a lot of people, it isn't actually that they need surgery on their eyelids, but it's often because the brow has fallen. You'll see this especially in people who have been outdoors a lot because they tend to squint. People with blue eyes, they'll tend to sort of pull their brow down. And just in some people, if you've already started with a fairly low brow, if it falls just a little bit more, all of a sudden you'll get this hooding on the outside because the brow tissue is now sitting on top of your lid. Your lid will then fall a little bit. And what these patients need is actually not an eyelid surgery, but something to lift up the brow itself. And there are a few different ways to do this. One is a direct brow lift. Works very, very well, where we do an incision right above the brow hair, take out a little piece of skin, it elevates the brow. You get basically a millimeter for millimeter lift, so it's a great way to do it. The only problem is you get a scar on your forehead. If you have a lot of hair here, which a lot of men do have, then it's great. You'll hide the scar, you won't even see it. In a woman or in someone who has very light hair, you can see the scar though, and it depends how you heal, so sometimes it's a real trade-off. You're getting a scar for the brow lift. Years ago, what everyone used to do, if you wanted to avoid this scar, is something called a coronal brow lift, and that was where an incision is made all the way across the head. And then what you do is you dissect it down and lift up the whole forehead and brow. A lot of trade-offs with that in that you get a scar all the way across the head, so if you don't scar well, you could get some hair loss. So some people have a bald spot across the top of their head. You also get a lot of numbness, which can be permanent because you've cut through all the sensory nerves at the same time. So for the last 5 to 10 years, what's become much more popular is something called an endoscopic brow lift. With that surgery, we make small incisions, 3 small incisions up along the top of the head, about this long, and then another small one over here to the side. Through a small incision, dissect down over the forehead, then lift the forehead up, hold it in position up here. The advantages to that are it's a very natural looking lift. You can do it on people with thinning hair. You don't get a large scar with it, and I think it really gives, in my hands, is really the best approach to doing the brow lift. What I want to show you though now is the mechanics behind it and the theory behind why this will work so well. And I want to show you a picture here so you will understand this at home.
And you think you get a more natural, better cosmetic result?
I do. And I think that so often people who come in, even if you need to have an upper lid surgery, I think when you do a little lift through here, you really put the brow back where it belongs and really give a nice look to the overall eye area and especially to the crow's feet. It's the only thing that will help getting the crow's feet is to get that brow off the outer part of the eye. So with the endoscopic brow lift, make small incisions up at the top of the head here behind the hairline, then dissect down, and you really need to dissect down all the way over the brow. If you don't release the tissue here, you really won't get much pull, so you won't get much of a result at all. Now, we used to use a screw, just put a screw into the head and then pull the tissue up and hook it onto the screw. What we have found actually works much better is to use one of these endotyne implants, and it's a little bit wider, so it gives a larger area of fixation. And you can see it here. It's sort of like a carpet tack, and it's this little plastic piece that's on the base here. So we stick this into a small hole that we drill into the scalp, into the head, and then you pull the tissue up, the forehead tissue up once it's all released, and you hook it on here. So it's like a little carpet tack. This will dissolve in about 2 to 3 months, at which point all the tissue is healed and your brow will stay elevated.
Now, does this eliminate the need for Botox, or?
Well, when we do the surgery, one of the most common areas for using Botox are in the frown lines. So what I do is I come in and I cut these muscles. You can actually take a little bit of the muscle out, but in some people, you still will get some action of these muscles, and then in those patients, it's good to use a little Botox here just to keep them from developing those lines again. The creases that go horizontally here may be improved once you lift up the forehead because people don't have to work as hard to lift up the forehead. But if they still have some residual lines they don't like, you can also give some Botox up in that area. All right?
Yes, thank you.
Okay.